So we are now recording. Welcome everybody to this webinar. I'm Janet McLean from Family Caregivers of British Columbia here in Victoria. And before I get started, I would just really like to thank Vicki Pilot for reaching out. We had a meeting last summer and it's turned into a great collaboration. Vicki was talking to us about how we might be able to help you folks in your work, and that's exactly what we try to do here at Family Caregivers. We're a backbone organization. I'll be talking a bit more about that in the presentation, but we can provide generic caregiver support to caregivers. So it would be terrific if that felt like a fit for you guys. You could refer some of your caregivers to us. Now, full disclosure, I've never used Zoom for a webinar. We are recording this, so I'm really hoping this will work out. And what I'm going to do now is bring up my PowerPoint. So I will share my screen. Okay, let's just see how if this is going to work for us. All right, so I'm going to actually start the webinar. So as I said, my name is Janet McLean. I'm the Education and Engagement Lead with Family Caregivers of BC. And again, really appreciate this opportunity. So what is this opportunity? Let's have a look at that. When Vicki and I met last summer, we talked about the alignment between our two organizations. And what we decided was that we have similar goals. Both of our organizations are interested in helping caregivers support their care recipients in a way that ensures their own well-being. We support family and friend caregivers across the province, no matter what the medical situation. We often refer to our services as generic caregiving. And what we've discovered is we get a lot of caregivers calling us who are caring for people with specific illnesses, but there's some very common needs across the care continuum. So I think that makes us a really good fit in terms of supporting your caregivers. In your work, you have contact with family and friend caregivers who are supporting stroke survivors. We have tools that we think can help if you refer caregivers to us for support, and our services are varied, and we're going to be discussing those today. So we are here to support you in your work, which felt like a really great collaboration. The goals that I thought we could aim for today would be, one, to reinforce the importance of identifying and referring family caregivers. And you folks have already provided some really valuable feedback about that. So I'm going to be trying to make this as relevant to you, but open as well to your input. Explain what Family Caregivers of BC does, so you'll understand when you refer a family caregiver to us what kind of support they might get. Understand the needs of your caregivers and the best way of working together. So that would be starting a dialogue with you folks to understand what's going to work better for you. Provide you with referral tools for easy referral to us. Review a couple of examples and initiate a feedback loop. I thought it would be important to start with a definition of what a family caregiver is. And for us, a family caregiver is an unpaid family or friend caregiver who provides care to an adult either at home or in a facility who has physical or mental health conditions, chronic illness, or frailty due to aging. And I won't actually waste our time with this, but just to let you know that previous to 2015, we were also known as the Family Caregivers Network Society. So if you don't recognize us as Family Caregivers of BC, you may recognize that previous title. But when we went provincial, we changed to Family Caregivers of BC. So just a little bit about Family Caregivers of BC. As I just mentioned, we've been serving all of British Columbia since 2010. And in the last 5 years with Ministry of Health Patients as Partners Initiative funding. So that is the program that we fall under within the Ministry of Health. But we have been around for coming up 30 years this July. We are one of 3 provincial organizations in Canada for family caregiving support, and we are dedicated 100% to the well-being and support of family caregivers. So this just really says it. And one point of clarification, when we talk about family, we mean family of choice. So that includes family that you choose to be family, so it could include friends. That dynamic is really starting to shift, and we're seeing that in our stats. Our mission is to improve the quality of life for family and friend caregivers through support, information, and education. And we provide leadership to strengthen the voice of family caregivers and the significance of their role. I'll be talking a bit about that in terms of our provincial work. And our vision is that all family caregivers will be recognized, valued, and supported as partners in care. Caregiving is really big, and I thought it would be important to include these stats, and I'll certainly share this presentation with Vicki so that you have it available. But we take a lot of our stats from the General Social Survey, and Statistics Canada does this survey every 5 years. So the last one was done in 2012. There will be a release of data very soon because they did another survey in 2018. And it gives us a real window into what's happening in caregiving. What we know from the statistics of the last survey is that roughly 1 in 4 people were caregivers at that time. And we know from some of the work being done provincially and from other provincial organizations that that's moving more towards 1 in 3. So it's a big percentage of the population that is acting as a caregiver. So roughly 28% of British Columbians are currently caregivers. And of those, roughly 89% care for more than 1 year, 80 to 90% care at home. The majority are women, and roughly 60% are employed. And we believe that's a real underestimate. We think it's closer to 70. In BC, just working from these stats, that would be over 1.35 million. And again, that's a real conservative estimate of what we think the true picture is. So when you think about that in terms of our province, that's a lot of caregivers. Family caregivers, what they do, and you folks will know this very well. Roughly 3/4 of them are doing things like transportation, getting people to and from, coordinating medical appointments. One of the most important stats, though, is the percentage that are helping with medical treatments and personal care. And at the time of the last survey, which was 2012, that was roughly 25%. Again, we're anticipating to see this increase. We believe that that percentage has started to increase. And this is the part where caregivers are really strained when the caregiving becomes, when they're looking after activities of daily living, so personal care, bathing, eating, mobilizing, getting changed. That's when caregiving becomes very intense. And it really adds to the strain on caregivers. We had this infographic done just to try and bring some data together. So for every hour of paid home care, a family caregiver provides roughly 10 hours of unpaid care. So again, it's just to illustrate the magnitude of the caregiving job and role. And we also know from our own seniors advocate work in British Columbia that 97% of home support clients have a family caregiver. So again, this is not an insignificant piece of information. But caregiving is a win. And so, so often in these discussions, it comes out as this big negative burden, people feeling put upon. What the General Social Survey found in 2012 is that 92% of caregivers report the experience as rewarding. 70% experience the strengthening of their relationship with the care recipient. Caregivers are best positioned to support care recipients in the environment and surroundings they choose, and care recipients receive care from the person who knows them best. So this is really important in terms of rounding out this whole picture about caregivers. There is, however, a big impact of caregiving on caregivers' health. And so what we know from some of the stats is that caregivers experience chronic health conditions at twice the rate of the general population. And so when we talk about that, what we're talking about are things like depression, anxiety, high levels of stress, hypertension, compromised immune systems, back injuries, insomnia, and this doesn't include financial impact. That's captured in this next slide. Again, from the 2012 General Social Survey, 60% of caregivers were juggling work and caregiving. 43% reported disruptions to their work. 15% reported having to cut back on hours. 14% reported losing pay and benefits. And 10% turned down workplace opportunities. And what we do know is that currently within Canada, the compensation available to support caregivers is still absolutely minimal. It's only available through things like tax breaks and incentives and some assistance for renovating homes and that kind of thing. So this is really, really significant. And again, just pointing out that we'll have new statistics on this very soon. And then on the other hand, caregiving supports our healthcare system. So we roughly, the imputed value of what caregiving provides is $25 to $26 billion nationally. Over 242 million hours of unpaid home care, and the value of that in BC alone would be roughly $3.5 billion. So it's really important for us to pay attention to this. The impact of caregiver stress, and again, this is a no-brainer, and this is why we're talking. The caregivers get sick and burns out. Then the caregiver is unable to continue supporting their care recipient, and then already strained community services are required to fill the gap. Unfortunately, at that time, the care recipient loses out by not having the value added of a family or friend caregiver. And this then, in turn, leads to increased utilization of acute care and facility-based resources. And that's what our system is trying to avoid. So what are the signs of caregiver distress? And again, I know you folks know this. Denial about the disease, and that turns into anger. We then move into social withdrawal, anxiety about the future, depression, exhaustion, sleeplessness, emotional reactions, and lack of concentration. And then that leads to all of the chronic conditions that we reviewed on the previous slide. What we know from the Seniors Advocate report that was done in 2017 is that the distress of caregivers is increasing. In her 2015 report, the percentage was 29%, and that's increased to 31%. And that's significant when you think about the numbers of caregivers. 34% reported feeling depressed, and there's a whole range of other causes and effects of that distress. So the system impact of caregiver burnout, and that's when a caregiver just says, I'm done. I just simply can't do this anymore. We see emergency department visits, ka-ching, $1,200 a visit. Days in hospital, $1,000 a day, and then the cost of facility-based care or residential care beds. So these are all things that our system is very interested in reducing. So the question that we always ask when we go to healthcare forums is, if home is best, who's at home? And it's the caregiver who is at home. So our common mission, the Stroke Recovery Association and Family Caregivers of BC, is how can we work together to support family and friend caregivers? We believe it requires a shift in the healthcare system and in our culture as a society. So we want to make sure that caregivers go from being invisible to being identified and recognized. They go from being unsure about what to do or who to turn to being referred and supported. And we want to make sure that they stop feeling excluded and they start feeling engaged and included. We like to think of the healthcare dyad as actually a triad. So this actual graphic was prepared by the Change Foundation in Ontario. If you haven't read any of their materials, they're fantastic, and they put a lot of time into research and evidence. So they came up with this, and it shows the triad as being patients, family caregivers, and providers. And we really believe in that, and that is how we present our work. So now we're going to get into what we believe we can help you folks with and your caregivers. At Family Caregivers of BC, we have 3 delivery pillars: education, caregiver support, and health system collaboration. The caregiver support is our first and foremost, and so all of our services are free, so that's the first thing that caregivers need to know. We have a caregiver support line, and that's the number right there. It operates Monday through Friday, 8:30 till 4. And on that line, a caregiver can expect to receive one-to-one emotional support, help navigating the healthcare system, access to support groups, a newsletter. They can subscribe to a newsletter that has timely articles. With the newsletter comes out quarterly, and referral to other community resources. We experienced a 36% increase in caregiver calls in 2017-18, and we're expecting that to increase again this year. We also received a 35% increase in calls from healthcare providers, and we're really thrilled about that because we believe it's one of the best ways for us to reach caregivers is through healthcare providers. We also offer a caregiver consultation service. So if a caregiver calls us with a very complex situation, and that can be where they themselves are starting to experience some medical concerns, which is compromising their ability to care. It can include transitions in care. Those are very difficult for caregivers. So if the care recipient is moving from hospital back into community, or moving from community into facility-based care, or even care between providers. So if they've shifted care from their GP to a specialist and trying to navigate that, we will sometimes refer those calls for a coaching, a caregiver consult, and we have gerontologists and nurses who man those calls. And what happens with those calls is they're more in depth, and we can spend more time and keep in touch with a caregiver over a period of time. We experienced a 216% increase in those consults last fiscal year. We do not provide counseling, so that's the only caveat. We do refer caregivers if we feel that some counseling would be helpful. And what we do around that is we try to find referrals to services in their local communities wherever we can. So we've worked closely with organizations like Here to Help, who have good listings of resources in communities, and we have a few other resources where we can direct people. And some of them we try to find income-based. Counseling is not inexpensive, but we will do our best to help caregivers find services that can help them. We thought it would be helpful to just review who is currently calling us. And right now, you're probably not surprised when you look at our slide that the majority of the caregivers who call us are females, which is very unfortunate because we know from statistics that roughly 47% of actual caregivers are men. But we are doing our best to reach out to male caregivers through support groups. And we have created a male support group here in Victoria as a bit of a pilot to see if it can make a difference in the referrals that we get from caregivers to our support line and to some of our other services. Typically, the caregivers who call us are calling for about either a parent or guardian or a spouse. So you can see parent guardian is roughly 57% and then spouse partner 25%. And it makes sense then that in terms of the age range, the typical age range is either 51 to 60 at 43% or 61 to 70 at 30%. Right now, and we're starting to see a shift in this, 56% are not employed. But as I said, with the increase in the number of caregivers who are caring for parents and also juggling work, that number is, we expect to see that increase with the results of the next survey. Call details. The reasons people call in this order were for information and resources, 37%, 25% for navigation assistance, and 22% for emotional support. I can't overstate that one. Very often what we find is caregivers, when they're calling us, they just need someone to listen to their story. And it's not insignificant. We listen for a bunch of things. So what is the current situation? What are their challenges in terms of the care recipient? But we're also really listening for what are they doing for themselves, because that's one of the biggest challenges. Caregivers don't look after themselves. And so we are really always trying to understand, how we might be able to help them with the care recipient, but really focus on what they're doing for their own health and well-being. 27% of our calls referred by healthcare providers, 18% by community organizations such as the Stroke Recovery Association. And then we're always looking at whether we're managing to reach across the province. So far, not bad in terms of off the island. 20% Fraser, 13% Vancouver Coastal. We're seeing those increase. We're including interior. Northern BC is still a challenge for us, so we would be really interested in working with coordinators in the north. We really need to extend our reach there. The outcome of our support line interactions is shown in the pie chart, and roughly 48% is information and resources, 14% navigation, again that one-on-one coaching about 16%, and emotional support 9%. And support groups 13%. So we still see the huge importance of providing person-to-person support. I'll be talking a bit more about that right now. So we offer free caregiver support groups. So just to clarify, we don't run all of the generic caregiver support groups across the province, but what we do is we provide support group facilitator training. And we have a community of practice for caregiver support group facilitators. And we also help community organizations start support groups. And so we have an idea of where we are lacking support groups. So again, Northern BC, parts of the interior. And we've made major headway in terms of establishing new support groups, both on the mainland and on the island. So that was our main focus last fiscal. We've run 6 support group facilitator training sessions. We have one coming up in Vancouver on March the 16th. And all of this information is always available on our website. So our website is listed at the bottom of the slide. It's the go-to place to find out about what's happening in terms of our different programming. We have an events calendar on our website, and that would be a really good place to check to see if there's anything happening in your community. We established 7 new support groups, and right now there's roughly 46 across the province. And we were pleased that we were able to start one in Prince George as well. As I mentioned, we have a community of learning or a community of practice for our support group facilitators. So they meet roughly quarterly, and this meeting allows them to get together to talk about the things that are coming up in their support groups, what kind of topics we might need to have new material created to address, just anything about facilitation that we can help with. So we're really trying to create a way to support group facilitators, because it is a peer-led model. So we do the training, and we support our peer volunteer facilitators in the support groups. We really, once the support group is up and running, we find that they're very successful. So, we've had a support group running in our office here the first Monday of every month, and, the attendance, goes up and down, of course, but we had a meeting this week and 11 people came out. So, it's just a really, really great way for people to feel that they're in the company of others where sharing is possible. And so it's one of our best vehicles to support caregivers. So this is just another slide to talk about, our training for support group facilitators. We'll help any community set up a support group. We offer the training, and we have materials that we can share. And our website has all kinds of resources that can be used to run the meetings. We'll be talking about that a bit more. Our testimonials for caregiver support. So I'll let you read this on your own, but you know, I think that the proof is always for us in the feedback that we receive from caregivers, and people who call our line, people who are you know, become part of a coaching session, people who attend our caregiver support groups. They're a really important source of feedback for us. And we also do surveys and evaluation and analysis every year so that we can continually improve our program and understand where there might be gaps and how we can address those. We also offer webinars, and so we are the only organization at this point in the caregiver world in BC that is offering non-disease specific caregiver support webinars. And so that it happens to be my area, and we run anywhere from 10 to 13 a year. And what I work hard to do is bring guest experts. So it's not us just talking about the things that you could read already in terms of our resources, but you know, I've listed some of the topics here. So we've had you know, webinars on everything about, you know, care across the continuum. So whether it's acute care, residential care, palliative care, and grief support, grief and bereavement, about caregiver processes. So we've had a session on grief action planning, decision-making tools, financial facts and tips, and then information about supports. And we find that some of our most popular topics for sure are things about how to support yourself as a caregiver. So self-compassion, boundaries, how to manage anger and guilt, being mindful, taking time for yourself, injury prevention and pain management. Our webinar views continue to increase. And so we record all of our webinars. They're on our website. So if you go under caregiver resources and click down to webinars, you'll see a listing of all of our webinars. And what we hear from our caregivers is that it's really great to attend an event, but caregiving sometimes makes it difficult to be in the moment and attend an event in person. That being the case, they can always watch a recording. So, you know, we're trying to make it as flexible and as accessible as possible for caregivers. And as I mentioned, you know, our views have increased. We get a really high rating on overall experience. And one of the most important indicators for us, we're always trying to track what actually happens as a result of someone attending a webinar. And 74% last year of the webinar attendees reported feeling confident they would be able to make a change in their behavior as a result of attending a webinar. So we're really trying to make sure that the handoff is something practical that they can use. And this is just a screenshot of one of our most popular webinars. It was on self-compassion, and we find that even though we did that last year, it's still getting lots of views. So, you know, it's like having a resource that you can continue to access. And a lot of our caregiver support facilitators also use our webinars as part of the curriculum in their support groups. And this just gives you an overview of who attends our webinars. So again, you know, 86% are female, and you would see a similar breakdown in terms of who they're providing care to. Again, the majority is you know, a parent, and followed by a spouse or partner, and then the same age ranges, 51 to 60, 61 to 70. And roughly the same breakdown in terms of employment. But again, we're seeing that start to shift more towards being employed. So again, I'll let you read the testimonials yourself, but we find that the webinar, particularly for those who attend, provides real opportunity for caregivers to dialogue with each other during the webinar. So we spend a lot of time in the chat room, really encouraging people to ask questions and you know, interact with each other. And it's one of the best reasons for participating in person. But the chat is also something that we make sure that we respond to questions, and those would also be captured in the recording. We have an extensive resource library on our website. So again, if you go under Caregiver Resources, you'll see that we have materials and handouts on any number of topics. So caregiving, caregiver health and wellness, family dynamics in caregiving, communication, sharing the care, navigating the healthcare system. All of these topics are covered. One of the things that we changed last year, and we're really trying to move in a number of ways to more interactive tools, and we're just working on our website to make to increase the interactivity. But we have a Caregiver Self-Assessment, and this self-assessment is a way for caregivers to go on at any time and during their journey and just kind of get a pulse on themselves. And so what we do is we're using this Caregiver Self-Assessment to direct people to certain topics. So that's a work in progress, but certainly on our calls, we use the assessment as a way to help ourselves and the caregiver together understand what might be some areas that they could focus on to help themselves, in addition to caring for the care recipient. As I mentioned, the top topics, accessing community resources, that's a really big one. Caregiving and employment, communication skills, distance caregiving, emotional side of caregiving, financial information, grief and loss, healthcare navigation, legal matters, palliative care, self-care, supports, and personal care. Technology, this is a growing one. One of our challenges, and I'm sure you folks see this too, is that we serve quite a diverse group of caregivers. So we still have some caregivers who are not computer literate, and that's why we still print a newsletter, and a lot of our materials are connect with people in that way. But there's also a growing number of caregivers who are very computer literate. They're looking for technological aids in their caregiving life, and there are more and more available. So this is an area that's really growing. And then, of course, transitioning to long-term care. Last year, we also added a flip book, and again, this is a way to help caregivers who might be new to caregiving, just to look at how to find the balance in caregiving. So the flip book goes through, if you're a new caregiver, what you might consider, and doing a bit of a self-analysis around balance, and so we're just trying to find different ways to reach caregivers about thinking about themselves. This is a screenshot of our last newsletter, and we collaborated with the Alzheimer's Society for Alzheimer's Month in January. And so, we are always looking to create those connections, just as we are with you right now, around how we can work together. And we could certainly profile heart and stroke when that works best for you. And, we want to build on topics that are of concern. I did a little bit of a scan of our call log, and from what I could see, roughly 12% of our calls pertain to people, caregivers who are caring for someone who has had a heart and stroke event. So it's not insignificant, and we can see that working with you folks will be the best for caregivers for sure. We also have, so if you subscribe to our e-newsletter, you will receive a monthly Caregiver eNews. And in the eNews that goes out at the beginning of every month, we have news about upcoming events of interest to caregivers. We list caregiver resources, if there's any new caregiver support groups or opportunities. We also are approached by a lot of organizations who wish to have caregivers participate in research studies or focus groups or events or sit on committees. So we include those kind of opportunities in our e-news. And yeah, it's just it's a good source of information about things that are coming up. So again, for you stroke coordinators in your branches, if you have an event that's coming up and you think that caregivers would be interested, just let us know, and we'll make sure that it gets into the eNews bulletin at the beginning of every month. So when to refer, what we say is every time and any time is a good time to refer a caregiver. And this screenshot here is of a prescription, a caregiver prescription that we had done mainly for healthcare providers. So this is kind of a handoff. If a doctor or someone in an outpatient clinic sees a caregiver who's struggling, they can give the caregiver this prescription, and it really recommends that the caregiver call us and connect with us to get support. What we have come up with, though, that I think would be maybe a bit more helpful for you folks is our caregiver consent referral form. So this allows us to be proactive in our approach to caregivers. So our goal is to make referring caregivers as easy as possible. So this referral consent form is on our website. As a coordinator, you can, with the caregiver consent, you can fill out this form and either fax it or submit it through the website to us, and we will then follow up with the caregiver. What we find about caregivers is they don't easily identify. They wait until there's a crisis. If we can reach them sooner, we can be much more helpful to them in terms of helping them anticipate the journey, understand what's ahead, not in terms of the disease, that's what you folks are going to do, but in terms of the caregiver journey itself and what kinds of resources are available to them, even some of the financial incentives or tax breaks, they may miss out if they don't know about them. So we really hope that this is a tool that will be helpful for you, and we are so open to hearing any feedback that you might have for us about what could make it more effective. We'd love to work with you on that. Right, so this is just about the prescription. I thought it might help to just run through a couple of examples of the kinds of calls that we've had from people who are caring for a care recipient with a heart and stroke condition. So example one, we had a daughter call us seeking disease-specific information and support group contacts for herself and her brother. Her father lives in the basement suite of her brother's home and has had many, many strokes, denies health problems, and refuses hospital care when he is unwell. This is a really common story. So the resistance to getting support, and yet the caregiver is feeling really, really stuck. The father is separated from his wife and has no power of attorney or representation agreement. So in this particular case, we listened, and I've highlighted the listen because that is so often the piece that no one else has time for, and that's what we're paid to do. So we can listen to someone's story, and we, direct the conversation, but it's really important we listen for how we can help with navigation, information, and referral, but we provide that emotional support, and then we move into some specifics. So in this case, we referred the daughter to disease-specific information and resources. So for example, if someone calls us and they're caring for someone who's had a stroke, we would always recommend that they get in touch with one of you folks to get the best support that they can in their community about the disease. Absolutely, that's the first thing we do. After that, we link them to our website where we have a lot of resources about power of attorney, advanced care planning, how to address care recipient resistance. We have a number of articles about that. We also suggested that they look at attending a caregiver support group. So, I think that gives you an idea of what we can do when you refer a caregiver to us. Another example, so we had a call from a wife whose husband had a stroke 6 months previously. He was admitted into acute care and returned home 3 months ago. She feels she's needing more support. The case management assessment that happened 3 weeks after her husband was discharged from hospital She said that that took about 15 minutes, and from her perspective, it was all about signing paperwork. They are currently on a wait list for an adult day program, and she's paying for private care 2 hours a week and is using a meal service program. She's feeling very stressed and drawing on community for supports with 12 plus friends taking her husband for walks and drives. She's been told the wait for home care placement is 4 to 6 months, but she doesn't know the process. Care home placement. And she wonders what she can expect from a case manager and feels she doesn't know much about her options moving forward. This is so common. I neglected to mention when I was talking about the calls that we received to our support line, we are finding that there's a significant proportion of the people who call us who are not connected to the system. And so I suspect that heart and stroke would be one of those categories, and this is the story that we've created around this. When somebody has a stroke, they and their caregiver go through an initial contact with the system. So there's an episode that's addressed and probably involved or may have involved a hospital visit or stay, specialist, their GP. So there's an intense period of contact. If they were in the hospital, they may have been discharged home, and there may have been, some initial support from home support, home and community care. But once they're stabilized and, they try to get on with their lives, those contacts kind of disappear and they're kind of on their own. And then things can be okay for quite some time, years. But typically what happens is there starts to be some more episodes. But at this point, they've long ago lost contact with the system. The only people that they're in regular contact with are probably their doctor and maybe specialists. But they feel completely, they don't know what to do. So the example that I just gave, I think, would be a good example of that. So the wife had some initial interaction with the system, but then it wasn't great, and then she's just kind of floating around out there. So we listened and then discussed, speak with your physician about your stress and the need to get more support. And the physicians are increasingly being connected with home and community care or home or community health service case managers. So it's one way, might not be the only way, for that case manager to become aware that caregiver needs some more support. Also request a meeting with the case manager. And we encourage caregivers to keep really good records of meetings, of things that are happening with their care recipient. We've got guides and tools and webinars about all of that. But request a meeting in writing. Finding a caregiver support group in her community, and certainly tapping in with the network that she's created with friends, which is awesome. A lot of caregivers don't do that, and we have a webinar specifically around creating a network of support so that she can attend a caregiver support group. Watching some of our recorded webinars on building cooperative relationships. So we have webinars specific to how to deal with healthcare providers, how to access community resources, and we also referred her for a coaching session. And as I mentioned before, our coaching sessions can mean that we have regular contact with a caregiver over a period of months. So we have the ability to sort of follow the situation over a period of time. So I hope that gives you an idea, and I'd love to hear from you about things that have worked for you, or if you have any. I'm going to stop sharing now so that we can go back to our chat room format. And Vicki, I'm not sure if you have any questions or anything that we could talk about to help clarify what we can work together. I would love, as an opportunity, I would really love to work with you coordinators to create a profile for, you know, what we could do to really enhance your information about the caregivers that call us. Maybe we could create a feedback loop. We could give you some stats. You know, what I would hope to see over time is that we would see an increase in referrals from the branch coordinators, and then we can work on, you know, how to improve our reciprocal contacts and services. So certainly willing to, you know, do whatever makes the most sense. So I'll just finish the presentation. As I said, I would really love to have any feedback and suggestions, and at any time. So if you're watching this as a recording, this is an open offer. We just really hope that you will take advantage of our forging relationship to get in touch with us and let us know what we can do to help. I'm going back to our goals for today, so I'm hoping that you understand what Family Caregivers of BC does to support family caregivers, that, you know, we've been able to address some of the needs that might be specific to caregivers looking after someone who's had a heart or stroke event, that we've established a way to work together moving forward, and that you know how to contact me. So yeah, so with that, I'm going to bring us back to our webinar, and if, you know, I think maybe that's it. So I'm going to stop the recording now, Vicki, which will, let me just